When it comes to HIV and breastfeeding, for decades, the answer from doctors was just a hard no. But what happens when the science starts to change the rules? Today, we're diving into an incredibly personal and complex medical question. Can a mother with HIV actually breastfeed her child safely? For the longest time, the whole conversation ran smack into this fundamental conflict. On one side, you have all these amazing benefits of breastfeeding. On the other, for mothers with HIV in developed countries, there was this one unmovable rule. Just don't do it. The risk of passing the virus to the baby was simply seen as too great.
You can imagine the impossible choice this created for so many women. But, science doesn't stand still. It's been evolving. So what's the new reality for families who are facing this exact decision today? All right, let's get into it.
To really get a handle on how big of a deal this is, we first have to appreciate what's on the line here, on both sides of the dilemma. Okay, so for the baby, the benefits are just huge. I mean, it's way more than just the perfect food. It's like a shield, building up their immune system, helping protect against things like SIDS, and even setting them up for better health down the road. And it's not just about the baby. For the mother, the benefits are just as significant. Breastfeeding really strengthens that incredible bond with her newborn. It's been shown to help with postpartum depression, and it even has real physical health benefits, like helping to prevent hemorrhage right after birth. So you see, this is exactly why for so long the official medical advice was so black and white. For a mother with HIV, the risk of passing on a lifelong condition to her child, well, it just outweighed all of those amazing benefits we just talked about. But then, something came along that forced the entire medical community to stop and reconsider that long-standing rule. And that game changer was highly effective antiretroviral therapy, or ART for short. These medicines are incredible. They work by suppressing the virus in a person's body, often to the point where it becomes completely undetectable in a standard blood test. And the result of that? Well, it's staggering. With modern ART, if a mother is able to maintain an undetectable viral load, the risk of her transmitting HIV to her baby through her breast milk plummets to less than 1%. I mean, that is a truly remarkable achievement. But this quote right here, which translates to, "But it cannot be said to be 0%, really gets to the heart of the tension. That risk, while it's incredibly, incredibly low, it's not zero. There is still a chance, even if it's a very small one. And this is absolutely crucial to understand. The famous undetectable equals untransmittable concept, or U equals U, which we know is true for preventing sexual transmission, well, it hasn't been definitively proven for breast milk yet. We just can't say with 100% certainty that undetectable means zero risk in this context. So because of this tiny but very real risk, the conversation about breastfeeding isn't a simple yes or no. It's more of a conditional maybe, and it comes with a really demanding set of rules for both the mother and her doctors. The option to breastfeed can only even be put on the table if a mother meets every single one of these conditions. We're talking about a perfect track record of taking her medication, having a sustained, undetectable viral load before the baby is born, and being totally committed to some intense monitoring, like monthly blood tests after birth. And then there are some hard stops, situations where the risk is just considered too high, and the option is taken off the table completely. This includes things like having even small temporary blips where the virus pops up, any issues that might get in the way of taking medication perfectly, or if the baby is born prematurely. You can see how complex this is, right? That's why the conversation between a mother and her healthcare team is more critical than ever. It has to be a partnership built on trust and open communication, not on judgment. Let's walk through a dangerous cycle that doctors are really trying to avoid. It all starts with a mother who, for her own totally valid reasons, has a strong desire to breastfeed. Now, if she brings this up with her doctor and is just met with a flat no, without a real supportive conversation about all the risks and the strict requirements, she's going to feel dismissed, maybe even judged. And that can lead to the absolute worst-case scenario. She decides to breastfeed in secret. No medical supervision, no monitoring, no guidance, which of course puts her baby at a much greater risk. And that's exactly why the new guidelines are all about a shared, informed, team-based approach. The goal is open, non-judgmental communication to make sure the mother feels completely supported, so that whatever decision is ultimately made, it's the absolute safest one for the baby. Okay, so after all of that, let's just boil it all down. What's the bottom line for an expectant mother with HIV today? Look, the absolute clearest, safest, 100% risk-free path is still formula feeding or using pasteurized donor milk. That is the only way to guarantee a 0% risk of transmitting HIV through feeding. And that remains the number one recommendation. So when you lay it all out, the choice becomes incredibly stark. On one hand, you've got an option with zero risk. On the other, you have an option with a very, very low risk, but it's not zero, and it demands an immense, unwavering commitment to a super strict medical plan. And all of this leaves us with a pretty hopeful question for the future, doesn't it? The science has already come so far, taking what was once a high risk all the way down to less than 1%. As these incredible treatments keep getting better, you just have to hope that this incredibly difficult choice will one day become simpler and safer for families all over the world.